organized by the Technical Working Group on Nutrition Research and the Malaysian Association for the Study of Obesity, or MASO in short. As we have an exciting lineup of speakers for today to share with us on their experience in conducting obesity research, I certainly hope that all of us have had a good, energizing lunch and ready to be inspired. Before we start the session today, here are some housekeeping notes for your attention. Please ensure that you are muted at all times during the sharing session to avoid interruption. If you would like to interact during the sharing session, please use the chat box. Please forward all your questions and comments to the speaker using the chat box. And if you would like to speak, please use the raise hand function in the reaction tab to indicate if you would like to speak. To avoid interruption, we encourage questions to be asked after the speaker's sharing. Ladies and gentlemen, Dr. Geeta Appannah will be the moderator for our webinar session today. She is the president of MASO and a senior lecturer in the Nutrition and Dietetics Department of University Putra, Malaysia. As an experienced researcher and an expert in the field of obesity, Dr. Geeta obtained her doctorate in nutrition epidemiology from the University of Cambridge and is herself involved in many research projects both locally and internationally. I believe that today she will lead us very well. Without further ado, let us kickstart our webinar. Dr. Geeta, the floor is yours.
Thank you, Kimberly. You can hear me well, Kimberly? Okay. So thank you so much, Madam MC here, for introducing me. And I'll be your moderator for today's session. I hope, yes, as Kimberly mentioned just now, I hope you had a good lunch and that you can really give your fullest attention for our topics today, to our speakers and their topics. Very interesting topics today. We're going to talk about, basically it will be more related to obesity research, from all the well-known speakers today. Okay, before we start, I would like to thank Badan Pemakanan, Ministry of Health, for inviting MASO to collaborate on organizing this webinar, which is rather timely, as to understand various research experiences, research gaps, from our speakers on the topic of obesity in Malaysia. Very important. We want to understand from them, what are the gaps, what are the experiences, that they have been through, in conducting their obesity-related researches in Malaysia. Okay. Before we invite the speakers, I would like to invite, get Professor Hamid, Professor Dr. Hamid, to give a little bit of welcoming remarks. As you probably know, Prof. Hamid is the chairperson for NRP in Malaysia. So he would like to speak something, as a welcoming remarks. Unfortunately, he can't be with us today, but we are going to play his video. So before Kimberly or Akin play Prof. Hamid's video, I would like to introduce Prof. Hamid. Someone that I think all of you know, who needs no introduction, but I still will do some little bit introduction about Prof. Hamid. He works as a lecturer at the Nutrition Program School of Health Sciences, University Science Malaysia since the year of 2007. He joined USM after completing his PhD at King's College London, UK. I know him since then, but we never met then. We only met in Malaysia when both of us got back. He has been worked closely with the MOH on being committee members for various technical working groups, especially for nutrition guidelines, children, adults, elderly, and other consultation activities with KKM and various other industries as well. And he is currently the chairperson of the technical working group for nutrition research for the Ministry of Health Malaysia. So we are going to play his video. Kimberly, if the video is ready, you can play anytime.
Assalamualaikum warahmatullahi wabarakatuh, and a very good evening, everyone. Thank you, Dr. Geeta, for the introduction. And here we are today to...
The video is not playing, only you can hear the audio. Sorry for the technical glitches. We will be back. Shikin, ada problem ke? You can't see the video yet, Shikin.
Maybe I will share the video, yeah. Thank you.
Jasmine, is it? Yeah. Jasmine? No sound, yeah? Jasmine, there's no sound. To share with us with audio. I still can't hear his voice.
Assalamualaikum.
Let me, Jasmine, let me share. Let me see. Let me try from my side. Okay.
Assalamualaikum warahmatullahi wabarakatuh, and a very good evening, everyone. Thank you, Dr. Geeta, for the introduction. And here we are today to share our NRP document a bit in my opening speech, and also to learn from the experts topics related to obesity. Before I go further, I would like to say a big thank you to the Secretariat at Bahagian Pemakanan for their effort in managing this webinar. And also a big thank you to the Malaysian Association for the Study of Obesity, or MASO, for their willingness to cooperate with us, with the TWG on Nutrition Research team. And it's very important that we keep the collaboration between agency and the NGO that is very important for the area of nutrition. As you all know, you may have heard this before, but for those who are new, I would like to indicate and highlight that the NRP, or the Nutrition Research Priority Document, is a very important document for all of us, regardless whether you are from nutrition or medicine or different healthcare area, because it highlights the critical gaps in nutrition research, knowledge, and evidence. And it's also highlight important issues, particularly in the Malaysian context. And it also aim to generate valuable information and evidence for policymakers to draw up and make informed decisions on new policies. I think policy are very important, especially related to obesity, where we are having big challenges now with the increasing rate of weight problems in our population. I think most of you know that it's 1 in 2 adults in Malaysia are having or are living with weight problems. So policy is needed so that we could find ways to help our people and help the government, and to make sure that the obesity prevalence could be, if not stopped, or could be reduced from increasing further. And the NRP also involved in creating or providing a platform for individuals or related organizations to optimize time, effort, and resources in designing, shaping, and future research. As you can see from the list of participants today, we not only have participants from the university, health ministry, other ministries, but we also have audience among students, and also from the industry, and also from NGOs. So you see, this is a very important platform, and we at the TWG Research are working very hard to make sure that we could engage several stakeholders, so that we could communicate, we could learn from each other, we could share the knowledge, and we could all work together as a team to make sure that the nutritional status of our population in Malaysia is well protected. The NRP documents is available online. You can get it from the Bahagian Pemakanan website. It covers 7 important areas, 7 research priority areas. Particularly today we are focusing on the overweight and obesity area. We have covered some of the other area in our previous webinar, but for today we will be focusing on overweight and obesity. And the NRP is developed together and in line with the National Plan of Action for Nutrition for Malaysia, which is ranging from 2016 to 2025. And for overweight and obesity, we are planning to linking it with the promoting healthy eating and active living, and also preventing and controlling obesity and other diet related NCD. You can see from this slide that obesity is not only isolated within issues with body weight, but obesity and overweight is also related to the increasing prevalence of non-communicable diseases that our country is facing now, particularly among our adults. Diseases like diabetes, heart disease, hypertension, these are all somehow related to diet and also related to the issues of body weight. Within the research priority area 5, we cover the topic of overweight and obesity. And this is a copy from the book. You can get more details from the book, but I just want to highlight that it has 3 important areas that within the obesity and overweight topic. First is to improve understanding on the epidemiology of obesity. So you can see these are issues that is highlighted within this scope. And we have updated it by having with the knowledge that obesity and COVID-19 is very much related. I think very rarely we see obesity is linked with communicable diseases. But in here, during COVID-19 pandemic, obesity and overweight became a very top topic because research has shown that people who are living with obesity or people who are having difficulties to manage their weight have higher risk of mortality or severity when they were infected with COVID-19. So obesity and overweight is not only related to NCD, it is also, with the current knowledge on COVID-19, related to non-communicable disease as well. So it is really an important area for us to cover in terms of socioculture, in terms of behavior, in terms of physical activity, genetic. These are all the fundamental important things that need to be studied by us in our country and try to understand what is the issues that leading to the epidemiology increase of obesity. Scope number 2 is focusing on the intervention. I think it is timely that all of us try to think of an intervention that could, help our population. Probably what we've been doing doesn't work well, so the intervention that we have done before may not be so effective. And with the current technology, with the information technology that we have, with the telehealth opportunities, the mHealth opportunities, and probably the different type of platform at school, at university, at workplace, at home, we could try to come up with a potential and possible intervention that could at least help in managing, help our people in managing issues related to overweight and obesity. And scope number C is to develop new modalities. We need to identify new methods to define obesity, or identify of novel strategies to prevent and manage obesity. Or probably we should have a way where we could identify individuals who will be kind of like who we predict will have issues with obesity and overweight, and we try to intervene early before he or she become overweight and obese. So this kind of strategies, like preventive strategies, early intervention, is very important, and we need to find ways how we could try to help in terms of reducing and preventing obesity and overweight if possible. And I just want to share RPA 6 because I think it is very much related to obesity. RPA 6 covers diet-related non-communicable diseases. And again, they were issued to strengthen understanding of etiology and diet-related NCDs, and then to develop and evaluate appropriate nutritional intervention strategies, meaning that in RPA, we need to focus strategies to reduce or prevent NCD, and to enhance nutritional care delivery system when one is already in the situation of NCD. And for this today, we are collaborating together with MASO, and I really want to repeat again my acknowledgement and my big thank you to MASO for helping us in organizing this webinar. This is very important webinar, not only for the technical working group of nutrition, not only for bahagian pemakanan, but also for MASO and for our country and researchers. Because as I mentioned earlier, obesity is really a big issue at the moment. Overweight is also a big issue at the moment. And we are all responsible. We all have the duty to make sure that we could come up with a good research, with a good intervention, with a good policy, so that we could link all this together, and in a way, we could engage several stakeholders and try to work on obesity interventions and strategies. And I would like to thank Associate Professor Dr. Geeta, who is the president of MASO, for agreeing to collaborate, and also the council members for agreeing to collaborate. And I also would like to mention a big thank you to my good friends over here, Associate Professor Dr Cheah Whye Lian, Dr Sameeha Mohd Jamil, and also Associate Professor Dr Azdie, Muhammad Abu Bakar. I think three of them have volunteered to share not only their research finding, but also their experience in terms of working in this topic in relation to grant management, grant achievement, and also how they were able to publish in journals in this area. So Dr. Cheah Whye Lian will be talking about very important area, which is in Sarawak region. We normally hear very less from Sarawak and Sabah. So it's good that Sarawak, we will learn more about the issues of nutrition in the region of Sarawak from Dr. Cheah Whye Lian. And then we will fly to HUKM in KL to listen from Dr. Sameeha in the area of obesogenic food environment. This is again, an obesogenic food environment is very important topic, and we are all living in this environment, whether in Kelantan or in Kuala Lumpur or Sabah or Sarawak. The obesogenic environment is with us all the way, all the time, and we need to be able to have strong will to overcome these challenges. And then we'll fly to Kuantan with Associate Professor Dr. Azdie, and he'll be sharing his experience, particularly on childhood obesity in the East Coast Peninsular Malaysia region. So it's very beautifully arranged. We have speakers from different regions. We have speakers from different level of experience. Some are very senior, some are junior. So it's good that we are here today. I think all the participants will be benefiting from this webinar today. Please stay with us, listen to all of the presentation, and I strongly believe that at the end of this webinar, you will be able to learn something and apply this in your work and in your research that you are currently doing or that you will be doing in the future. I think that's all for me. The opening remark is not really important. The most important are the speakers here, and we really appreciate their presence and their effort in sharing their experience and knowledge with all of us. And I also would like to thank all the participants who have registered and who are here attending this webinar, spending your valuable time to be with us, to support our activity, and also to support our mission to help Malaysia in terms of reducing the prevalence of overweight, obesity, and NCD. Thank you very much, everyone. Assalamualaikum warahmatullahi wabarakatuh.
Okay, so thank you so much, Prof. Hamid, wherever you are listening to us. Thank you for your very comprehensive welcoming remarks. You have mentioned the important part of today's collaboration with KKM and also with MASO on this topic of very much interest recently, and as you have already highlighted in your welcoming remarks, we know overweight obesity has been linked with NCD to a lot of extent, yeah. But during pandemic, we also know that this is also one of the risks for the severity or the hospitalization of COVID patient. So that's also another important factor with regards to communicable diseases as well. Yeah, so it's not only affecting non-communicable diseases, NCD, it's also a risk for COVID especially. So, and you have also already introduced our speakers, coming from different regions and on the different topics and in terms of the seniority as well. So we are going to hear more from the speakers. Without any further ado, let me introduce our first speaker today. Yeah, Dr. Associate Professor Dr. Cheah Whye Lian. Yeah, she's already here. And let me read a little bit about her. Yeah, I think you know, some of you probably know, yeah, Associate Professor Dr. Cheah Whye Lian already. She's an Associate Professor in the Department of Community Medicine and Public Health, Faculty of Medicine and Health Sciences, UNIMAS. Yeah, she has a degree in nutrition, Master in Public Health, and PhD in Community Nutrition. For the past few years, Dr. Cheah has been actively involved in the research focusing on nutritional well-being of children to adulthood, specialized in community setting. Yeah, she has a lot of community experiences that she probably will be sharing with us today. She has knowledge in conducting, yeah, not only quantitative but also qualitative and the mixed methods research as well. Her work also involves studies among the indigenous groups of Sarawak, which is very interesting. We really want to hear more from you, Dr. Cheah. Very hardly we dengar, or hear any findings from Sabah, Sarawak, as how Prof. Hamid mentioned just now. And you also already looked at the interaction between cultural and health behaviors, particularly among the Iban and Bidayo communities. She was the principal investigator of several projects focusing on NCD among adolescents in Sarawak intervention study on preschool children. So it's not only adults, but Dr. Cheah also looked at children cohort as well. She has been actively involved in teaching of research methodology for undergraduate and postgraduate level. Her current role in managing academic quality has created interest in the area of using innovative approach in the assessment of teaching and learning. Yeah, so Dr. Cheah, if you are ready, the screen is yours.
Good afternoon. I hope that all of you can hear my voice.
Yes.
Thank you for the introduction. I want to thank my colleague, Prof. Hamid, as well, Dr. Geeta, and the rest of the team. When I was asked to give a talk about Sarawak, I think I wanted to share this because not many people actually understand when we talk about the indigenous group of Sarawak. But talking about that, there's a lot of indigenous community in Sarawak, but particularly of my own interest, actually, we wanted to look at what we mean by the Sarawak Dayak. So that's why the presentation today actually mainly just sharing our work, because we have started this work since last year, combining people from different background. And then the most interesting things that we want to share is about looking at building up what we call it profiling. Profiling means to say that there were not many baseline data with regard to this particular ethnic group of Sarawak. So this I hope that it will be more like sharing, and later on you will see some of the preliminary data which we have not actually published, but we are still doing our data collection. So, hold on.
Cheah, your slide is in the mode that you can see both your notes.
Oh, okay. Let me wait. I need to change the setting first. Okay, how about there? This is better, right? Okay.
Yeah, this is
Okay.
better. Thank you.
Okay. So when we talk about Sarawak, I think that the first few things that I need to highlight is that when you look at we talk about the demography the statistics, the Sarawak total population. The IBAN has the highest population. This is based on 2020. We are looking about 1/3 of the population in Sarawak actually are from the IBAN. So when we talk about Dayak, by definitions, we are focusing 3 major groups. That is the IBAN, the Bidayu, and the Orang Ulu. And basically, when I first, I must inform all of you, I'm not a Sarawakian, but when I first came to Sarawak, I confused. I could not differentiate all this ethnic group. But as years goes by, I'm already here in Kuching for almost like 29 years. So basically, from the costume, we know that they are from different groups, and you can see the one that those who visit Sarawak, the first thing they will see are all this cultural performance, which actually they have very colorful costume, very colorful way of the features, everything. So they, in fact, that if you look properly, they're actually a bit different, right? If you look at the definitions of Dayak, or we spell it as Yak, they call it Dutch Dayak, the non-Muslim, with the word is the non-Muslim indigenous peoples of the island of Borneo. So mostly these people actually traditionally live along the banks of the larger river, and they have this particular language actually come from the origin of the Indonesia. They call it branch of Australasia. And in Malaysian Borneo itself, which is often been called as Borneo by a lot of all those foreigners, basically we're referring to 2 major groups, that is the Sea Dayak and the Land Dayak. The Sea Dayak mainly are the Iban, and the Land Dayak actually are the Bidayu. And we also have other Dayak subgroup like the Kayan, the Kenyah, all that. So they have, in a way that they look quite similar to, if you go to a country like the Philippines or a bit crossover, you'll see, or the Kalimantan side, they have these very similar features that actually come from the same origin. But having said that, in terms of the language, they actually say different. You cannot understand the Iban because they are different from the Bidayu. Even from the Bidayu also, they have different subgroup that they talk Bidayu, but the language actually quite different. Now, when we talk about ethnic food itself, because of the nature or where they come from, most of the Dayak actually come from the river and they are farming people. So basically, most of their diet or the food come from the forest as well as from the sea. So that's why when you come to Sarawak itself or to Kuching, these are the common things that people will look for. And I believe that some of you, when you come to our so-called Pasar Tani, they will look for all these very popular one. A lot of people like to eat is the paku. In fact, in paku also, we have many types. We have the paku, we have the midin, and then within the paku midin, they also have the different. So you will be confused if you don't understand when we say the term paku and midin. And the other one, that very famous one, a lot of people come to Kuching, is talking about the ayam pangso. Means that say they cook the chicken in the bamboo, and then they also have what we call it the daun sabong, or even Bidayu they call it daun doda. These are the common leaves or vegetables that consumed by the local. And they also have what we call it, another very famous one, they call it the trung dayak. They call it the Trung Asam. This is actually quite, in a way, that is supposed to be from the same family, from the eggplant, but then it's in yellow in color, and it's the taste actually is sour. We also have another one that very common among the local, we call it the rice wine, or they call it the tua. and many more. So if you look at the diet itself, in fact, they actually look pretty healthy lah, except the rice wine lah. So what happened is that it's supposed to be good because Dayak food is made by local natural ingredient, the wild animal meat or the fish, the leaves, the roots, the bark, and many other. So that's what contribute to the uniqueness of Sarawak gastronomic culture. But what happened? What went wrong? If you look at the data study by at the Malaysian national level, like for example, this particular study, they found that despite being come from the river, come from the farm, the report saying that the issues of physical activity still remain a problem. So study done by Propo and the group indicated the same pattern. And we also have another group going in, particular this the second study and the third study actually initiated by our team, trying to look at what will be the nutritional status of the local community, particularly the Iban and Bidayu. So they have quite a number of them actually, like for example, 39.6% of them actually were found to be overweight. And then 40% in certain rural and urban of Kuching Semarahan division also reported almost similar, coming to about 40%. And then we even went a little bit more, looking at some of the so-called CVD indicator. For example, this particular one, androgenic index of plasma, also indicating that Iban and Bidayu, they have significant higher of AIP compared to other ethnic group. And we also have some looking at the metabolic syndrome, as well as some of the non-alcoholic. All these are, we call it, related to obesity study that indicate that this particular group of community in Sarawak actually are not what we call it, exempted from having problem with obesity related disease. Now, the story coming is where our team comes in. So we have actually gathered, I have initiated looking at this particular group of people. We have come up with a group of people that actually looking at various areas. So what I did is that I have gathered a few people. We have two clinicians from the background of radiology. We have this Dr. Ko Ai Chien, Dr. Yu Ting Ting, and then Dr. Lau. And then we have another lady, she's on physiology, Dr. Miak Subo, as well as some of our postgraduate students to come in to, start this particular, we call it a Dayak study cluster. And for the past 2 years, I think more than 2 years actually, we managed to obtain some grant from FRGS, from our own UNIMAS grant, the Dayak Chair grant, the pilot grant, as well as the RISE grant. All this grant itself actually come, which lead to what are the things that we wanted to look at it. So basically the whole team, we are trying to start with this thing. This is just only the beginning part of the story when we are trying to look at the cardiovascular risk factor, looking at non-alcoholic fatty liver, and then we want to look at the adiponectin relation to vascular risk factor. We also want to see some of the nutritional health promotion package in improving the knowledge, attitude, and practice among the indigenous community of Sarawak. And we also wanted to look at another one that quite interestingly, we want to see the household food insecurity, which actually claimed by many people in other parts of Malaysia, particularly among the, they call it Orang Asli. This issue is something that has to be addressed. So we want to see whether such an issue actually are related, relevant in this part of Malaysia. So because of the data has not been completed in collection, I have to put a disclaimer. So we are not, whatever we have presented today is meant to be a preliminary finding. And we are not ready to actually claim this and that until we complete the whole work and publish in the journals. So I hope that you can understand. Now, objective of this study, some of this study, we focus on a few things here. Number one, we want to look at the profiling of the social demographic, looking at the nutritional status, particularly looking at BMI, waist circumference, and waist hip ratio. Looking at the lipid profile, we are taking blood, and we also looking at the physical activity, smoking, alcohol consumption, as well as some other, we call it clinical indicator like adiponectin, keratin intimate thickness. This is done using a ultrasound scan, looking at the non-alcoholic fatty liver disease. Also, we are using an ultrasound scan, gallstone disease. And then lastly, we are looking at the prevalence of metabolic syndrome. Well, these are some of the methods. We go into the field, we took all these things, weighing, measuring, taking blood, ultrasound scanning. So what I want to share is that this is the social demographic profile. I think that this one, we will not go into the detail, but what I wanted to share is this one. So out of the total number that we have collected so far, 49.3% were found to be obese, with 36% overweight. Among the male and female, they are 53.3% at risk, with we call it waist circumference big, I will say, and waist hip ratio also indicated female are higher than male. Now, in terms of the so-called physical activity, which we are using an iPad questionnaire, we find that strangely, 56% of them, they claim that they are having high activity, which is quite interesting. Then, hold on. Now, this is the blood result that we indicate. 20.8% were found to have hypertension. Elevated blood glucose is 21.7%. Adiponectin, 77.5% will classify as high. High cholesterol, we have about 59.1%. And then LDL is 43.8%. And lastly, triglyceride, 59.9% high. Right, this is another interesting thing. This particular keratic intimate median thickness actually indicating the what we call it, the systemic atherosclerosis burden. It can actually predict the risk of developing future cerebrovascular, or we call it cardiac thrombotic. So what I understand from my team member is that the minute they scan this part, they can actually predict your thickness of the whole body, because this is the part that actually will indicate whether there's any, we call it risk of atherosclerosis. And then the other one, we are looking at what we call it, the thickness of the keratic intima media. So indicating 8% of the population that we have screened were found to have what we call it possible with 2 or more CVD risk factor. And the other one we are looking at, we call it keratic plaque. Keratic plaque is the one that indicating whether there's any, we call it incidence of plaque in the artery, that we actually will increase the chances of you getting stroke. So out of the whole population that we screened, 25% has indicated they have higher risk of, thicker, we call it plaque in the carotid artery. Now, in terms of the non-alcoholic fatty liver, we have found that 10.7% are under the category of 3, indicating that it is high risk, because category 3 means that there is a marked increase in liver echogenicity, which indicating that fatty liver, common term, fatty liver. Okay. Now, in terms of gallstone, we find that 4.7% reported to have gallstone. They were further to be referred to further investigation and confirmed. Now, metabolic syndrome, we have about 29.6% reported to have, we call it a risk factor of having metabolic syndrome. Now, the second part, I want to talk about a bit about the double burden of malnutrition, because this is the part that we actually wanted to look at, relate to obesity in the rural, where we want to look at the mother and child. So based on this study, we have indicated that 79% of our mothers were found to be overweight. This study actually combined the mother and child. So out of the total population that we have surveyed, the PET, household with double burden of malnutrition, we are looking at 25% with overweight or obese mother and teen or stunting or underweight children. Okay. Now, the last part that I want to talk a little bit about this, we call it the household food security, because when we want to link up to all these issues about understanding what caused the obesity, one of the things that we wanted to look at it is looking at the issues of food security. So the study have shown this part, we have about 8.9% of them, which actually have what we call it a child hunger, and then 11.1% reported to have individual, we call it insecure, and then 21.1% household insecure, and lastly, we are looking at about 57.6% of food secure hunger. So with that, I conclude my sharing. And I was asked by Dr. Geeta to talk about a bit about what we call it the part on we call it so hold on, I want to stop sharing this. The part when I want talking about how to actually build up the whole team. I guess that basically that is not easy when we want to start to build a team. What happened is that you must have someone to lead the group to actually come up with that. And I think in any other established university like UKM or USM, they always have a very senior person to lead the team. And I think that in this case, in UNIMAS also, we did the same thing. We need to have someone to come forward and then gather the junior staff and come in and then set the direction. And then a bit, because without a small grant, without any small grant, without any baseline data, without any strong profiling, it's quite difficult to actually to get a bigger grant coming in. So with that, I conclude my presentation. Thank you very much.
Thank you, Associate Professor Dr. Cheah Whye Lian. Very comprehensive presentation on your work that you have done. Although it sounds very prelim, yeah, but there's so much data already there. And I wish you all the best with with the further analysis, further work that you have with regards to this study. Okay, we will keep some questions for you at the end of this webinar. Yeah, we hear from the other speakers first, and then we will have one session just for Q&A, where we will gather all the speakers together. So please, participants, please. Wait, please stay here, stay tuned, and stay here until the webinar, where we'll hear some more comments or some more opinions or feedbacks from our speakers. Not only the data that is being presented, but obviously you probably have more questions that you want to know beyond what is being presented. Yeah. Okay. So next, thank you, Dr. Cheah. So moving on, we will have Dr. Sameeha here. She's already here. Dr. Sameeha Mohd Jamil. Yeah, let me introduce Dr. Sameeha. I call her Dr. Sam. I think a lot of people know her with the nickname Dr. Sam. Okay, so Dr. Sameeha, she's currently a lecturer in nutritional sciences program. Center for Community Health Studies, REACH, in Faculty of Health Sciences, UKM. Her research areas are on food marketing, food retail, faster power among children, strategies to promote healthy food requests among children in the supermarket and qualitative study. Very, very interesting topic. I also want to learn more from you, Dr. Sameeha, with regards to this, promotion of healthy food requests to children. Yeah, especially most of us, we are, parents of young children. It's sometimes very difficult to convince them to get the healthy food. Yeah, the unhealthy one, no problem, but the healthy ones is always a problem. Okay, we will hear more from Dr. Sameeha about that. Before that, Dr. Sameeha is also a writer in MDG, Malaysian Dietary Guidelines, and also for MDG for children and adolescents is currently in the stage of writing, and she also has been invited as one of the panel for nutrient criteria for food advertising in Malaysia by Nutrition Division MOH. Dr. Sameeha, if you're ready, the screen is yours.
Okay, thank you, Dr. Geeta, for the kind introduction. I'll just share my slide. Can you see now?
Yes, I can see. Yeah, if you
Okay,
put it.
let me share screen. Okay.
All right. Hold on.
So I'm only given 20 minutes for this presentation, so I'll try and abide by the time. And the content of my presentation. Can someone please mute those who are the audience? Okay, so Secretariat, can you help, please? All right. So the title that is the ones that I've been told to share my experience on this research that I'm currently handling together with Prof. Po Bikun from UKM. So the title is The Role of Food Retail in the Obesogenic Food Environment. So just a brief introduction about the funder. So IDRC stands for International Development Research Center and is based in Canada. And for those of you who don't know, actually IDRC gives grants to the developing world. And especially for Malaysia, this is a good opportunity for us. If you are interested to apply for this international grant, please have a look out at their website. They have all the information there available, their application form, how to apply, and the ones that we got was from under the Food, Environment and Health Program. From Malaysia, the ones that I know, I think Prof. Tila has received 2 grants from IDRC before, one on food advertising, and the other one was on food epi. So this is the research team of this project. We are headed by Prof. Po Bikun, myself from UKM, and this is a multi-country study which involves not only Malaysia but also Thailand, Philippines, and Indonesia. We are also being helped by 2 consultants, Dr. Anne-Marie and Dr. Helen from University of Sydney. And under the Malaysian team, we have 2 statisticians and 1 retail researcher, Dr. Cheah from Faculty of Economics, 2 GRAs. And also for this study, we are backed by an international advisory group, which comes from Australia, Canada, and South Africa. So if you are interested to learn more about the project, this is a protocol paper of the CEAOFE study. So this is what we call ourselves, Southeast Asia Obesogenic Food Environment, taking into account that this is a study involving 4 countries, Southeast Asian countries. And this paper was published early this year, okay, in January 2022. So a brief introduction, this one talks about Southeast Asia, all the 4 countries' problems, especially related to overweight and obesity. But I'd just like to highlight on Malaysia. So as you all know from NHMS 2019, 1 in 2 adults were overweight and obese, and this was found highest among females, Indian ethnicity, and among the age group of 55 to 59 years old. So what are the research gap and why do we want to take, why did we took this retail food environment research on board? Okay, so it's actually to clear some of the gaps and questions. Number 1, it's unclear to public health policymakers what the retail food landscape looks like. If you go back to NSM 2020, when where I presented on food marketing among retailers. There were so many studies that has been done on the availability of healthy and unhealthy food in developed countries. So there was one paper done by Dr. Luca Thornton and also Dr. Adrian Cameron, where they looked at the availability of healthy, unhealthy food in 8 developed countries. So they were UK, US, Australia, Denmark, Canada, Sweden, I forgot 2 more. But there were, at the moment, what we see now is like it's a bit of non-existent among the Southeast Asian region. So we'd also like to know how the average consumer interacts with the retail food environment. What are the drivers of food retailer in terms of their decision making when they stock their products? What public policies are of most relevant to food retail and why? And COVID has also caused disruptions in terms of the supply and demand of food items. So the SEO-OFE objectives, we have 4 phases. So we put it into 4 objectives. Number 1 is to look at the national food retail landscape. Number 2, this is a consumer intercept survey where we explore consumer experience, and also we measure the availability of healthy, unhealthy food in the retail food environment. Objective 3 is to analyze the retailer decision making. This is an interview. And then number 4 is where we engage stakeholders and we tell them, okay, these are the results of the 3 studies, and this is what we think we should do in terms of trying to change policy or improve the policy for Malaysia. So again, this was taken from the protocol paper if you're interested to know more about the study. So we have the objectives here, or the phases, and then what are the methods that we're currently using, what are the expected results, outcome, and we actually engage stakeholders not only at the end here, we actually engage them from phase 1. And then every year we will have meetings with them to share with them our findings. So looking at the experiences in the grant application, it actually started in, if you see here, April 2018. So it was actually earlier started by our team from Indonesia. And then it was submitted in March 2019. And then after that, it went cuckoo for a while. Everything went quiet. We tried to email, there was no response. And it was when Dr. Lian and I went to Hanoi that we met an IDRC representative, Mr. Greg Helen, and we asked them about our proposal. And what happened then was that the staff who was in charge of the proposal, she left. And so that's why it didn't proceed. So he asked us to send back the proposal. We got the corrections, and we corrected and resubmitted in November 2019, and we finally got the grant in 2020. So if you see here, the period is about 2 years. Yes, so it was a bit long, but it's not because IDRC's grant application is like this. It's just because it's just from our experience. It's through this period that it went, because of the silentness, it took quite a bit of time. But if your application goes smoothly, it should be no problem. Okay. One thing about IDRC's grant is that the one that I want to share here is they will ask about gender consideration in the study. So in the beginning, we were like, gender, how to do? Because as nutritionists, like we just do socio-demo, we measure gender, and that's part of the study, but we don't actually look at gender equality. But if you look at retail food environment, it's something like, you know, why in Kelantan, in Pasar Siti Khadijah, they were all women who sells food, but the men probably works elsewhere. So try to think of gender when you do your questionnaire or when you do your interview, because that is part of the grant application. You have to also include gender. So in our study, we included a few questions on who buys most of the grocery stuff in the supermarket. And why do they buy the stuff? Because usually the women are the ones who goes grocery shopping, right? Except for probably during MCO when there's only one household. And then if you remember, the men like don't know what is the difference between lengkuas and halia because they've never been to supermarket before. So this is one tip that I would like to share if you are interested to apply for IDRC grant in the future. So in terms of looking for or finding the retailers for our study, we applied this AHP process, which is analysis of a hierarchy process. It's like a questionnaire, and then we have to do some calculation. So we give this to the stakeholders, so people who are expert in retail, retailers, retail lecturer, and also people from the ministry. And from there, we calculated, and what we got for Malaysia is that the ones that we should focus on are hypermarket, supermarket, and convenience store. Initially, traditional wasn't in the picture, but when we presented this to the stakeholders, they actually asked us to also do this similar study to the traditional stores. So this include Kedai Aceh and Kedai Runcit. This is how the mapping of food retailers look like. So first we use QGIS. We selected 3 parliaments with the highest number of urban poor population living in the PPR. So the highest number of people living in PPR in these 3 parliaments. And then after that, we map 1 to 4 kilometer radius from the PPR. And then we just map all the retailers, yeah, that is around. So we didn't include a wet market in this study. So just sharing some of the meeting with stakeholders that we had. So these are all like one-to-one online stakeholder engagement. And then we finally group them all together to meet and discuss about our questionnaires for phase 2 in December 2021. So some of the experiences that we have experienced in data collection. Number one, we have finished phase 1 in March 2021. However, for phase 2 and phase 3, it's still ongoing. We have decided to prolong the data collection due to inability to collect data because this requires us to have a face-to-face interaction with the consumer, intercept survey, and also interview. Although interview can be done online, but the phase 2 data was a bit difficult. Yeah. Also, we have to measure the availability of healthy and unhealthy food in the retail stores. So this is a bit prolonged. For phase 2 intercept survey, what we found difficult was that many participants were reluctant. So if you don't know what intercept survey is, it's actually our enumerators and researchers having a booth outside the retailer. And then whenever consumers come in and out, we ask them to fill in the questionnaire. And if they are not interested, we give them a QR code and ask them to do it at home. But you know, with intercept survey, that kind of, oh, do you want this? Do you want that? People thought like our enumerators were selling credit cards, and people avoided contact, and they say like, oh, okay, I have fish here or ice cream here, it will melt. And then they say, oh, sorry, we don't have time. So QR code was another idea that we had to give to the participants, but even then, some of them didn't fill in. Okay. In regards to the retailers, this was also a difficulty that we found. We have like a logbook where we email, we call, and we even go through LinkedIn. We send hard copy letters to invite them to participate in the study. But there were some good responses, some bad ones, and some of those who do not want to participate, they say issues like they need to recover from COVID, so they do not agree or give permission for us to measure the availability of healthy, unhealthy food in their retail store. Another reason for them not to say yes was this is from a convenience store. So the representative said that their stores sell mostly unhealthy food items and ready to eat food, and it will not be it will not give good result to our study. So even with these responses, right, we will just say that, oh, okay, actually, we don't want to penalize you. We just want your thoughts. We just want to know what you sell so that we can tell the stakeholders to incentivize you to promote more healthy stuff. But even so, some just didn't respond. Okay. Some of the good responses from retailers. So after like 2 weeks, we will email back, just send them a reminder. They will email us back and say, okay, so we want to know more about your project. And then we will initiate an online meeting and we share about the whole program, project objective with them. Okay, so this is towards the end of my slide already. Some of the advices for researchers working who are interested in similar field is number one, reconsider your method, especially intercept survey. I know there's another UNICEF study who is doing similar research in other countries, and what they are doing, I think what they did was they use AC Nielsen and collect data online, and that is quite fast compared to intercept survey. So if you have more budget, think of that as a method, or think of other methods and not intercept survey like what I've already shared with you. Yeah, we had difficulty in finding respondents for this study. Next is to find senior researchers who have experience in the field and make them part of your team. So in our study, one of our research team from Malaysia, she is also doing retail research with one particular convenience store, and it's very easy. So whenever we want to collect data, we will just tell her, okay, we have this letter ready. She will say, WhatsApp to me, I will send to her. And then we will get response immediately. We were like, wow, so fast. So if you have good networking, or if you have people who, when you want to find your team members, try and find those who have relevant experience and who already have contact with the retailers that you want to engage in. Okay. Number 3 is for GRE. I'd like to, this one I learned from Prof. Po. For GRE, if you know that your research is looking at policy, working with ministries, inviting them as part of your stakeholders, try and find someone who is on study leave and they are from the ministry themselves. So in one of our GRAs, he's from the Youth Kementerian Belia dan Sukan. So Prof said like, oh, maybe we should take him as GRA because he knows the selok-belok of working in ministry, application, applying letters, what letters should be sent, what kind of wordings we should write. So this actually helped in our research here. So one was a fresh graduate with a first class honors, and another one with relevant working experience but working in ministry. So try and think of that when you have a grant, and what is your research about, and try to find GRAs that can suit your research study. Okay, and in my opinion, there are so many things that can be done on food retail, because we haven't even touched on pasar tani, pasar borong, pasar malam, and also the petrol kiosk. Imagine if you're going balik kampung, and you stop by the petrol kiosk, what do you buy for your kids at petrol kiosk? Do they have cut fruits? They don't. Some have, I think one in Bangi, the one that I see here, they sell. But most of the retailers that we see, they are lacking of healthy food. So this is something, there are more work to be done for us nutritionists, and it is our obligation to actually do more for the country, okay, for the future of our next generation. Experiences in data collection process. This one already, right? Okay, so how would the research findings translate into nutrition policy? So we are currently at phase 2 and phase 3 now. For phase 4, what we plan to do is that we plan to share with the stakeholders the results of our phases 1, 2, and 3. And then after that, we will hold interviews with them. And for phase 4, the expected result is to identify key opportunities for policy to encourage change within the food retail environment to support increased availability of affordable, healthy food. What does this mean? So this means things like, you're telling the stakeholders, you're telling the ministries, okay, these are the policies that you have right now, but these are what the retailers are telling us, these are what the consumers are telling us, and we kind of like triangulate this, and this is what you can see in terms of the availability of healthy, unhealthy food in the supermarket, in all the retail stores that we collected, and how can we tell the retailers to promote more healthier stuff? Probably we give tax exemption or tax redemption, or we incentivize the retailers to stock more healthy food in their stores. Okay, so in the intended outcomes will be for countries to provide retail experience of the food environment and existing food policy context, including barriers and opportunities for policy change, which we will get from phase 2 and 3. And also it will provide regional and global evidence about the existing food environment in LMIC, low middle income countries. In the pointers that the Secretariat gave me, they wrote if you are looking for collaborators. So unfortunately, we don't at this moment for this study, but we are on the lookout for one GRA for our phase 4 study. So if you know anyone, or if you are interested and you fulfill the criteria, please email me or Prof. Po. Thank you very much.
Thank you, Dr. Sam. Thank you for your sharing. Thank you for your sharing of your experiences and also your study, study conduct. I believe there is not much on the findings yet. Even with the process, the earlier process of actually getting it and working together with few international collaborators and setting up the study in Malaysia with regards to phase 1 study, it's already good enough. It's very interesting. I really look forward to see your findings soon, yeah. And also hopefully you get to do the phase 2 and phase 3, and you have it until the phase 4, right? Yeah, phase 4. Yeah. So all the best with all the phases, and hope to see findings from the study published and being disseminated to our public, yeah, in terms of how we can make, when we talk about collaborators, we also want to collaborate together with the retailers, right? We want to work along with retailers, we want to understand their perspectives. Why can't they have the healthy food as opposed to unhealthy? Is it something to do with demand and supply? So we want to hear more and to read more of your findings soon.
Thank you. Thanks, Dr. Geeta.
All right, so Dr. Sam, we tunggu ya sampai the end. We have a few questions for you as well. We'll keep it later. And participants, if you have questions, please you can chat. Yeah, you can actually write in the chat box now. If you have any, if you takut you forget, you can actually type in the chat box. Yeah. And I will then pick it up later during the Q&A session. Participate in Facebook, you can do so as well. Yeah, type in the comment section and we will pick it up from there as well. If you have any question, yeah. Or you can wait, those in Zoom, you can wait until the end. During Q&A session, you can actually, if you want to speak, you can raise your hand and speak and ask your question to any of our speakers today. All right. Okay, so our last speaker is here. Azdie is here. You can see him already. Azdie, thank you so much for doing this for us. Azdie is our council member and he was more than willing to do this, to share about his research experience with regards to childhood obesity in East Coast Peninsular Malaysia. Before Dr. Azdie start with this presentation, let me introduce him. Dr. Wan Azdie is an associate professor in the Department of Nutrition Sciences, Kuliah of Allied Health Sciences, International Islamic University Malaysia. He's based in Kuantan. He obtained his bachelor and master's degree in nutrition from University Kebangsaan Malaysia, UKM, and completed his PhD at the University of Wollongong, Australia. He actively involved as a member in several technical working groups and committees related to nutrition under the Ministry of Health Malaysia. A lot of people know him, because of his contribution and because of his network, and locally. His main research interest is in the field of nutrition, of course, focusing on public health issues, including food security, obesity, and also nutrition education. So Dr. Azdie, over to you.
Thank you very much, Dr. Geeta, for the introduction. Assalamualaikum warahmatullahi wabarakatuh, and very good afternoon to everybody. Bismillahirrahmanirrahim. Alhamdulillahi rabbil alamin. Wassalatu wassalamu ala ashrafil anbiya wal mursalin wa ala alihi wa sahbihi ajma'in. Subhanaka la ilma lana illa ma 'allamtana innaka antal alimul hakim. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. ولا حول ولا قوة إلا بالله العلي العظيم. ولا حول ولا قوة إلا بالله العلي العظيم. Can you see my slide now, everybody?
Yes, you can see.
Okay, thank you very much, Dr. Geeta, and excellent presentation from Dr. Cheah, situation in Sarawak, and of course Dr. Sameeha about the obesogenic environment that we are living now. So it is my turn. It is already close to 4 o'clock. Inshallah, I will talk about part of my FRGS studies concerning childhood obesity in Kuantan, Pahang. This actually has been completed right after the pandemic started. In the end, in the beginning of the 2020, I've closed this FRGS. So basically, during that time, we still have the opportunity to go to the communities and whatnot, and after that for 2 years we have stopped doing that for a while, and alhamdulillah now we can start going back to the community, right? Okay. This is just the overview of the obesity in Malaysia from the NHMS 2019. You can see that both for adults and children, the trend of obesity is increasing, and what I've shown here in the picture is about the latest landmark in Kuantan, Pahang, which is the 188 Pahang, Menara Kuantan 188. Okay, so basically I've been in Kuantan for nearly 20 years and looking at the urban sprawl, and I really agree with Dr. Sam's explanation just now that obesogenic environment is happening, and we need to do something to avoid from our nutritional status to become worsened, right? So going back to my FRGS last time, which started in 2016, we would like to have a look at the status of the nutritional or the BMI nutritional status of the children in Kuantan area. So we start with the anthropometric measurement, and among the questionnaires involved are the socio-demographic data. At that time, we haven't finished translating the FIES. You can have that in our MGN. My team published in 2021 the translation of the food insecurity experience scale. But during that time, we haven't have yet that. So we use the Redimer-Cornell hunger and food instrument, food insecurity instrument. And then we also explore the usage of geocoding, GIS, similar to what Dr. Sam used just now, right? And then we try to map it out and have the results after that. So basically, this is the result for the BMI status of the primary school children. So 64% of them are normal and 16% are overweight, whereas 12% are obese. For the underweight, it's about 7.8%. Interestingly, in Pahang, we are the number 3 in terms of stunting. So currently, one of my projects is about studying about the stunting issues in Pahang as well. Primary school children's height for age, we can see that normal 90% and 10% are having issues with stunting. Thinness also is still prevalent in Pahang area, in Kuantan area. And the BMI status among secondary school children, quite similar to the primary school children, where 60% are normal, 16.6% are overweight, 14.2% are obese, and we still have the 9.2% of underweight school children. You can see here also stunting is also still an issue. We also measure the food security status among primary and secondary school children, and we can see that food secure is very low compared to those who are having issues with food insecurity. So child hunger 34%, 5% of individual food insecurity, and household food insecurity is about 35%. So basically in Kuantan area, we have both urban and rural areas. We have both high income group people and low income group of people, and the mix of socio-cultural and demographic background. We try also to map the distribution of school children according to BMI status. So we can see that this area basically is the Kuantan town, Indra Mahkota, as well as the Kuantan city. And then towards up here is what I can see that urban sprawling is happening, where the fast food outlets increasing. As I mentioned last time, nearly 20 years ago, there's only about 1 or 2 KFC, and I don't think we have McDonald's at that time, and we have A&W at that time. But nowadays, Kentucky got, Chicago got, Texas fried chicken also we have in Kuantan, not to mention other types of food outlets. We also try to make the buffer analysis of fast food outlets location from the school's location. But even though we can see that the trend is there, but there is no significant association between the the availability of fast food around the schools with BMI status of the children. This is because we only look at the fast food. I'm sure that in Malaysia we can see that the pasar malam, hawkers and things like that are abundant, right? And that is the way in the future that we would like to also study in terms of the environment. From this FRGS, these are among the outputs other than the findings. In terms of human capital, from this FRGS, we have 1 PhD student and 2 master students, and some articles and presentations that we have successfully presented and written or published. And the results basically still, some of it still under process. We are planning to also publish another article coming soon, inshallah. So you can see that one of the beauty of doing research is the results keeps on coming as long as you know how to do the analysis, how to play with the data and things like that. Another experience that we can gain from doing research and gaining grants from the government is we have to present, we have to also join with the community, and these are the experience that not only us as the researcher learn, we also training our future nutritionists to also go into the ground and learn and about communicating with the community, how to arrange the time and things like that. Dr. Geeta also requested to share about research experience, right? So basically the one that I presented comes from my first FRGS, and it is not only the first trial of application. This I just a screenshot from my grant system. As you can see that quite a lot of no and 1 yes, right? This is part of it lah. Ada lagi 2-3 yes after this. And you can see that the FRGS approved in 2016. And then before that, basically, I've applied using the similar proposal, right? Using the similar proposal, but it was turned down. Then what the things, and this is maybe some tips that we can share. What the things that I do is I change the apa nama kita panggil, dia punya cluster tu, from health and medical sciences, I've changed to social sciences, and then I've rewrite and to show that how obesity also affects social and cultural areas. On top of that, with the usage of GIS and the indicating of food security issues, it shows that a lot more things to be connected with the community, basically. Right. Other than that, what I can share also, when you are applying for grants, perhaps you should identify the national priority areas. What are the countries heading towards to? What are the priority at the moment? And I think now food security is one of the main theme, right? Other than sustainable living, healthy planets, healthy plates, and things like that, right? You can see. And of course, NRP is one of the national nutrition research priorities that we're focusing on the nutrition area. And other than that, as mentioned by other speakers just now, where we should be prepared, bukan minggu depan nak tutup, minggu ni baru nak buat proposal. It doesn't work that way. And then work in team, of course, we try to find a mentor or a senior member who have published and as well as who have successfully obtained a number of grants, right? And learn tips and tricks from them as well. And also the main important thing is don't give up. One trial maybe fail, second trial maybe fail, and after a number of trials, inshallah, out of 10, perhaps 1 or 2 will be yours, right? With that, I think that's it. Thank you very much and wish everybody all the best. Back to you, Dr. Geeta. Just a short and sweet presentation from me.
Okay. All right. Okay. Thank you, Dr. Azdie. Short and sweet. I can say that, yeah, short and sweet. You did mention about your findings and so your research experience, yeah. And also, it's not like, one time we apply, then we get it, yeah. You need the perseverance.
That's right. Another challenge, I think, Dr. Geeta, here we are in Kuantan, right? It's quite hard to get research assistant. You see, people are focusing more on Lembah Kelang area. Yeah, my first time, not FRGS, before that I got raised, I waited until more than 1 semester to get a student or RA to help me with the project, you see. So that is among the challenge of the researchers.
Understand. I can totally understand. We have a lot of difficulties these days, These days, students are not many students are interested in doing research. So I can even understand, being in the East Coast, being in Kuantan is probably double of our challenges here. Yeah. Yeah. And being perseverance is the key. Yeah. Many of us, we have a lot of experience of being rejected, being declined. Yeah. But we keep on doing what we can do, yeah, by revising our approaches or revising our proposal and so on. Yeah. So well done. And keep your perseverance, keep your keep being persistent lah, yeah, in this area, honestly. So thank you so much for your sharing. Okay, now can we have all the speakers back on screen, please? Dr. Cheah, if you're still around. Dr. Cheah ada? Dr. Sam ada?
Ada.
Okay. Dr. Sam also ada. Okay. All right, thank you so much to once again to all the speakers. Wonderfully done. We're very glad with the how our webinar went, yeah, so far, yeah. Very glad with all your sharing and so on. So I think we can start with our Q&A session now, yeah. If that's okay with speakers, you okay, or you want to get a break 1 to 2 minutes ke apa? Nak ke?
Oh, tak payah.
Just continue, ya. Okay, dah nak petang pun ramai nak balik pun lepas ni kan. They want to wrap up and balik already, yeah. 4 o'clock now. Okay. I have a few questions. We also have a few questions from some participants, which I already got it here. Dr. Cheah, I have a question for you. Okay, based on your prelim findings that you shared just now, with very high prevalence of obesity, especially, it's almost like at the national level, right? National level kind of prevalence. What is the role of socioeconomic status among the respondents? Where do you see this is more focused, like this is more concentrated on? Are they coming from the lower socioeconomic level, or are they coming from the higher, or is it do you see any trend or no trend at all? With regards to national data, we don't see any trend. Top 20 pun ada isu tu, bottom 40 pun ada isu ni, right? Not real trend there.
I think that that's the thing, because when we started to look at the past report especially some of the data they publish, I think there was one particular article they actually say that this so-called indigenous group, particularly the Dayak people, are still, it's not coming to the mainstream, mainstreaming in the city, all that. But such a trend is actually have changed, because if you look at now, there are more highly educated community from the Dayak community. And then if you go to the kampung, all that, you see that their houses, everything no longer the small hut, all that, they are actually building their own house in the kampung, all that. So you can see that the socioeconomic status actually has significantly improved. And for that reason, because as I said before, if you look at the nature of they call it the social aspect of this community, they like to socialize. So when they relate all this activity, all that to food, so it becomes something like part of the culture. So because of that, in addition to all the urbanization, the fast food going in, all those things, so no longer we should look at like what we used to think that rural community mean they are looking at we call it, underweight, all those issues. No longer. I think that basically what actually compromised all this, because of their socioeconomic activity are changed. They are no longer farmers or doing all those hard labor thing. So that itself already compromised. But what makes us very interested to find out, because in the IPAD report, it seems to be they are pretty active, they claim. But then, to me, what went wrong, it could have been the intake of food maybe they eat too much that kind of thing, because they claim that they're active, unless that we use a more objective kind of measure like pedometer, all that.
Right.
So that is something that we need to explore. That's why our in the first place, when we look at the weight, because there are some previous study I did before, is that you can see that certain diseases are more prominent in certain ethnic group, just like we talk about diabetic is more common among the Indian, that kind of thing. So here also we also want to figure out that among the Bidayu, Iban and other ethnic group, well, is there any genetic, or we call it things that actually influence, is it only affecting part of the community on the talking about high cholesterol or metabolic syndrome, that kind of thing. So a bit more later on, if there are more money, we will look at the genetic per se to actually find out that is there any protective, factor actually prevent them to get, high blood or all these things. We don't know. So we are just, that's why I said now is the critical time to actually build up the profile. Then from the profile, then we can move on and apply for a bigger grant, and then we go in looking at the genetic, all this kind of thing that will be interesting.
That's right. You need to convince the funders, with regards to some.
Yeah. Because right now, definitely none. And then I forgot to mention also we are bringing another 2 group coming in. One is looking at the Helicobacter, where relate to stomach cancer, because there's quite a lot incident. I mean, they report don't know whether it's actually true among the Klabit. The Klabit actually are from the Barrio Highland. So that itself also another group of ethnic group that, they're actually quite big, you know, the size. So these are the things that coming in. And then another area is NPC, throat cancer. But that one, we could not find any method to actually to screen. NPC, you cannot screen using blood, everything. So, but but there are a lot of cases among NPC among the Bidayuh community because of the preserved food they take.
Yeah.
Mm.
It's quite common among in Peninsula. I think it's probably more common among Chinese as well, right? And
True,
people
because they relate it to the all this salted fish, you know, consumption of, you know, the ikan tenggiri, masin, all that. But in Sarawak itself, it's more towards the preserved food, like they call it preserved fish, preserved wild boar, you know, the kind of meat, they call it exotic. So we are concerned about those things. There's a lot of things to dig here.
I'm sure there's a lot of things to dig, you know, we want to dig as much as possible, but
Yeah.
how, when, with what kind of resources and so on, that's a different question.
Yeah, that's why I mean that since we have about 100
Are
participants.
those the preserved foods? Are those their traditional food as well?
It is.
I
It
see.
is. Because you must remember that back in the old time, there's not much of, we call it freezer or refrigerator.
Yeah.
So most of the time they preserve their food using salt.
Mhm.
So that's where they call it, there's another term, I mean the Strakin will know when I say the word pekasam. Pekasam is a method when they preserve the fish, you know, into using salt, and then it becomes something that very appetizing and they love it. So because of that, it could have been consumptions of the fish more, or because of it's so appetizing that they take more price. So you need to
Like with
interestingly,
belacan, sambal belacan lah. Got sambal belacan, eat more rice. Similar to that.
betul. This is the call it the appetizer. The term appetizer is quite obvious already. Okay.
Right. Thank you, Dr. Cheah, for your input on the socioeconomic. I guess it's because of the urbanization, we don't really see it much of
Yeah, but I do welcome that I mean that now that we have such a big group in this talk, you can always contact us, you know, if you're interested to do more, because there's a lot of thing to explore seriously in Sarawak itself.
Thank you, Dr. Cheah, for your invitation to work along with you. Yeah, a lot of data. We need more people to look around.
Sure.
Look at the data different way, right?
Yeah.
We look at one direction, but we need more eyes, more brains to look at it.
Betul. Before I retire lah, sir.
Okay, thank you, Dr. Cheah. All right. Now, Dr. Sameeha, I have a question for you. Okay. Actually, somebody asked you a question. So, let me ask participant my question first. I reserve my question for later. Sameeha, thank you for your sharing of such an interesting research project. I appreciated that you had stakeholder engagement at the beginning of the study, which is very important to ensure the translation of research findings into policy. You mentioned about the AHP, analysis of hierarchy process, right? Can you elaborate a little bit more on that? What do you mean by AHP and how we interpret the data like?
Oh, okay. I can't really remember it offhand right now, but it's actually a set of questionnaire that stakeholders have to fill in. In terms of detail, you can contact me if you want to know more, but I think they ask about the retailer, what do they think? It's more on the perspective of the stakeholders involved. However, they also look at other areas because you have to calculate based on their answers. So it's a very complicated process. And in terms of calculating and why we actually engage in that AHP is because Dr. Elaine has a background in supply chain management and also small small medium enterprise, SME. Yeah. So she was the one who initiated and moved it that we have to, in order to choose which retailer to choose, we need to use this AHP to get the retailers that we want. So I can't really tell offhand and in detail. It's quite complicated, but contact me so that I can explain it to you more. Thank you.
Okay, Dr. Sameeha.
Mm.
I guess, yeah, if you want to know more, please contact Dr. Sameeha. She's more than willing to share, probably your work on the area. Dr. Sameeha, I just want to ask you, what was your experience like? Not was, I think you're still working with some of the international collaborators. What is your experience like working with international collaborators? How do you keep the chemistry? How do you keep the momentum together with regards to your study?
Oh, okay. So I think the team members, you're talking about the Southeast Asian members, right? Or are you talking about the international advisory group? Which one? Or is it the whole thing?
Yeah, yeah.
Okay, so the IAG actually helped in the protocol of the paper, just ensuring that we abide by all the rules, and based on their experience, they can also tap in and say, okay, why do you wanna? Because they do ask, like, why do you need perspective of consumers? Why is it so important to you? It's better to just measure the availability so that you get the evidence. Perception is nothing. That's from their point of view. But we were thinking, like, it's better to get the perception of consumer, the perception of retailer, and also to really measure what is being sold in the retailers, so that we get an overall, a comprehensive evidence. Okay, this is what we found. So how are we going to do about this? And what are the changes that we can make from the policies that are there for Malaysia and for the other countries as well? In terms of the synergy between the team members from Indonesia, Thailand, and Philippines, they are a bunch of young people, young researchers who are really, really motivated, and they really do their task well. And I'm quite fortunate because I think also because I get guidance from Prof. Po, I learn a lot from her. In terms of like selecting GRAs and how to measure. She's very detailed in that sense, and she also guides all the young ones, all the young researchers, when we do wrong and when we do right. We meet regularly, not to say like every 2 weeks, but whenever the need arise, we will have a meeting, and they are very committed to their phases. So for example, phase 1 is from Indonesia. So Indonesia will make sure, okay, these are the template, fill in by this time, fill in. And then phase 2 is from us, from Malaysia. We had to develop our questionnaire, and we had to improve on the audit tool that we took from Australia. So that took quite some time, but they were very helpful in trying to make sure that their food categories are also similar to ours, because we are very nearby, right? Southeast Asia. And then phase 3, it was Dr. Elaine who is involved in the interview, and she knows more about retail. So that's her expertise. So we let her do, and we just give her some ideas or guidance in terms of interviews. So we say like, because she's more quantitative, and so we tell her, you're doing qualitative, so it should be like this, like this, like that lah. So far it has been going on very well. I'm very grateful, and I hope it continues to be this way. And we're going to meet for the first time physically in ICO in Melbourne. Unfortunately, I cannot go, but the rest of them are going.
All right.
Thank you.
So it's good it's very important, I guess, to keep all this synergy or some good momentum, good chemistry between the collaborators, especially when they're coming from different countries. Because culture of doing research is probably different and so on. But if you manage to find people who you can work along very well, that will be a plus, very, 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 very much at a plus side. But unfortunately, sometimes we don't get the good ones, or the one that we can work along. So that's why I asked you a question on that.
It's luck lah, I think luck.
Probably, but I guess with mentor being working with mentors, probably another thing that's very important as well, because mentor probably will be able to advise you accordingly, if at all, if you have any problem, in maintaining good relationship with people. Sometimes we just need another person, right, to talk to, or to share our of a story and so on. So mentor is really very important. But keeping a good chemistry with mentor is another thing as well. But that's a that's a different platform. But in your case, you have a very good mentor, definitely. You know, Prof. She's very good. She's a wonderful person. Okay. Now, thank you, Dr. Sam. Dr. Azdie. Okay, Dr. Azdie, just now you did mention about capacity building, right? I guess very important. Probably Dr. Cheah, Dr. Sameeha also will agree on this point that, you know, it is important that when we get a grant, we have to have students, we need to have research assistant, research officer who can help, because we want to help in terms of the capacity building, right? But do you agree that we need to have this component of capacity building, regardless of the amount of whatever amount you're getting from, you know, from funders? Do you agree that we really need to have capacity building, or is it just enough with, you know, whoever researchers that you have within your team, you just work along with your research team members, but you don't have to have a student or research officer or anything that you need to train with regards to your research projects? What do you think?
Right. I think capacity building or talent development is very important as well, right? We won't be living here until forever, right? One day we will pass our knowledge, our skills to the next generation. So I think it's okay to work with with only our team, but for me it's important to transfer the skills, transfer the knowledge, and train the new generations to do that. Regarding the fund, your point mentioned earlier just now, no matter how much we get, right?
Yeah.
The payment is also an issue, right? Of course. So it depends on how we plan our project lah. If we don't have anything, also we can still work with our final year project, final year students. But if we have research grants, this is where we can do more with money, right? We can take 1, 2, or even 3 research assistants, depending on how much we have, and the expansion of our project tu kan, how big we want to cover. Yes, I think talent management, talent development is very important, where we train not only to do and collect data, they also need to learn how to manage the money, right? We learn that already, so we need to also train them how to manage the money and plan carefully. Sometimes it happens that mismanagement of money happens, right? So this is how we train them to plan, actually, what to buy, where to spend, where to go to, and things like that.
Yeah, agree with you, Dr. Azdie. I really agree with you. We need to have more new generations, more of future generations who's able to do research. We have to be able to guide them, and teach them, guide them, assist them as much as possible in terms of doing, you know, ethics, research with ethics. So
responsible research.
Exactly.
We need to run our research responsibly.
Yes. So capacity building is really very, very, very important. So whenever we, you know, if with regards to FRGS or any of the KPT's grant, we do put some promises there, right, in terms of capacity building. How many students we're going to have, how many students, master students or PhD students that we're going to have. So I guess it's really important that if you have that promises, might as well to fulfill that. So the planning has to be really good in terms of your how many numbers of students you can have for that research. Dr. Cheah, what do you think?
I think that it has a point. Because I think that basically, but having said that, I think it all started with my own philosophy lah. I think that as when we come back from our postgraduate training, all those things, I think the first thing that although that we wanted to specialize to what we are supposed to train, but I think that everyone had to go through the process of just jump into any boat and learn, because it might not necessary to be the topic that you want or not. Obviously, if you can have a topic that of your own choice, you'll be good. But to me, as a young people, you should actually go into the field and learn, because I think most of us agree that when we do research, it's basically from our PhD training, actually is not adequate. We will have to have many years of field experience to come back and so like my team that a lot of them are very junior staff. So coaching is important now. So that's where I share my experience in the field, and then along the way we also learn, because to me field is like an open textbook, live textbook that you cannot. So I tell a lot of young people, don't be too choosy. Just go in, and then even in the part when we talk about publications or writing, all those things, you just write, and then you don't need to go for impact factor or anything. You just the first few rounds, you just have to get the experience of being rejected.
Yes.
then after that you learn. As another, I always say, don't feel so bad. As they say, oh, rejected once. I say, you haven't seen us rejected 8 times. So basically the younger people now, I think a lot of them, they want to have something like, they call it like, shortcut lah. I mean that, but you agree or not, you cannot apply for a bigger grant if you don't do well in a smaller grant.
Yeah.
So I mean, like what I like this Dr. Wan has this experience, if you have, like, for example, like Propo or that, you're very fortunate because these are the our mentor. But people like us don't have anyone here, but far away from, somewhere in that place, you're on your own. So that's where you started to understand a lot of things lah. So I think most important that if you can get a good mentor, follow the mentor. If no, start from small, try everything. You'll be better. Okay.
That's right. Thank you so much for your sharing, Dr. Azdie and Dr. Cheah. I'm sure Dr. Sameeha also will agree on this, that we need to train more and more younger people in doing research responsibly. And another thing that we probably need to give a lot of attention to that is like how to keep them resilient. Yeah, because a lot of people give up in the middle of the way, in the middle of their projects. It's just can't take it anymore. It's probably a problem since last time, since our times as well, but it's just becoming more and more common these days, because we are youngsters. So we got to be resilient. We got to teach them to be resilient as well. So a lot of responsibilities we have here. All right. Dr. Cheah mentioned about publications just now. I just want to touch, probably it's one last question from me, and just want to ask all of you, any of you can speak here, Dr. Azdie, Dr. Cheah, Dr. Sameeha, if you have any opinions about this. When it comes to publication, there is a saying, publish or perish. Yeah. And Dr. Cheah did mention just now how many times that sometimes we are rejected up to 10 times. I have an experience of being rejected, a paper being rejected up to, I don't know how many times, 7, 8 times. Yeah. Students also almost give up. I have to like push the student, motivate the student, inspire the student all the time. All this process of inspiring and motivating is also very tiring at times. I am sure you understand me on that statement. But this question that I want to ask you is, how do you make sure that you are not over publishing from one single study? Mak Saleh kata, how do we avoid from salami slicing finding from one single study? Dr. Azdie, if you have any opinion.
Okay, as you can see from my presentation just now, we have separated between primary and secondary, right? And then some of the findings also we separated between urban and rural, right? So I think that types of separating in terms of analysis is okay, but it depends on your niat. It depends on your niat, because I understand your question. Some people just want to produce or publish as much as possible from one simple project, right? That's where the slicing comes in, right?
Yeah,
so basically
very thin slices.
Very thin slices. Somehow at the end of the day, you can't really connect all the dots, right? So at the end of the research, as we mentioned about responsible research just now, we want to come up with something that is usable, something that is people can make it to become as a reference, right? So to become what do you call it, menjadi contoh for other people, that we can learn something from that thing, right? If you slice it too small and you can't really make a good conclusion out of your study, so it will defeat the purpose of doing research, right? Perhaps it fulfill your KPI. If your KPI requires 4 presentations, 4 publications and things like that, but it goes back to our niyat as a Muslim, especially, it will be counted. What you plan to do, how you have been given such amount of money, how you make use of that, it will be questioned in the hereafter. So for me, responsible research not only counted, not only up to your final report, but it has longer implications. I think other culture also have these types of understanding, where the outcome of something must be usable for other people as well. It must benefit the ummah, as in UAE we call it. It must benefit the people. It must benefit the community at the end of the day. So don't be selfish as a researcher.
That's right. Yeah, that's right. Thank you so much. That's very, very, I guess, very important that you mentioned. We have to be very, balanced in terms of like how much papers should come from one single project. Yeah, because otherwise you'll miss the puzzle. I mean, puzzle dah lengkap dah, ni dah macam lebih daripada, you're no longer answering what you want to answer in the beginning that you wanted to do the study. Yeah, Dr. Cheah, do you have any opinion?
I actually thought that I agree, because usually the first question I will ask is that what is the bigger impact? Meaning to say that if you decided that you want to go for an impact factor journal, then your data had to, good enough to go into that. So when good enough go into that, you have to go back and look at the data. Is that I think all of you will have agreed that we will want to, squeeze as much as possible to actually qualify to call as an impact manuscript to be considered for the impact factor journal. You know very well they will not take any kind of, very isolated, lack of, methodology, sound kind of thing, all that. So to me, that is important. So dissecting all that, to me, it should be, if you can fulfill your main objective of publishing in the impact factor, then the rest, sisa-sisa tu tinggal tu boleh lah, you boleh cuba. But I always emphasize, sometimes it's not about the quantity, but it's more towards the quality. Yes, because I think you all agree that KPI doesn't look at all those non-Scopus index journal. So you have to think about that. I think that most of us have problem. It's not because of publication itself, but it's the cost of publication. I think that so reputable journal, all that with high impact come with the publication fee, which is very expensive. So we most of the time we cannot meet that kind of requirement as much as we want to publish. That's why I always tell my colleague that think about it at the end of the day, which is more important. If you say you want to hit a Scopus index and then you don't have money, then your data have to be very good, because they don't charge you any fee. But if you have a Scopus index journal with a publication fee, probably you have a little bit of freedom to actually, play with the data and so forth. So there's a lot I think it's quite politic when we talk about publication itself. But for beginners, especially those people who started to write, please do not think that you must hit a very big impact or whatever. Just get the experience of writing, finding your style. Kan gaya the cara penulisan tu very important, because when people read, people know it's you. That should be the they call it the highest achievement that we want to reach. So that that's your standard lah. It's not the KPI thing lah. So
standard, right?
You punya standard sendiri lah. Macam orang terdengar suara you berlagu, they know it's you already. It's
that's right.
Somebody else, right? So that's my take home message lah. All right.
That's very nice, Dr. Cheah. I think all of us need to have our own gaya, our own style, right? That's why we also teach our students not to plagiarize or not to copy other people's work. We need to have our own way of writing, or way of doing research. Yeah, so that's our uniqueness in terms of writing. So that's where we have to learn. And as you said, Dr. Cheah, it's not a 1-2 year kind of thing. It's like, it takes several years for us to have our own style. I'm not sure whether I already have my style, but I'm still trying, learning, and understanding myself in terms of how
Still building the culture. Me too.
Exactly.
Correct.
Yeah.
And then in the other thing that I also learned over the years, that the more you write, is that we call it the reciprocal process, that the more you write, you are recognized in the public, and then people will look for you to review papers. So it's like a chicken and egg thing. So both things, if you realize that the more you write, you are known in the group, in the community, then everything come in.
Yep.
So quality or not quality at the correct. In the beginning, to me, it should be seen more, quantity, seen more. Any paper, you just write anywhere, and then slowly when you are more popular, you'll find that everything will come in beautifully.
That's right. Thank you, Dr. Cheah, for your input on that, publication ethics and so on. Yeah, but Azdie as well. So well done on doing it. With some principles. All of us need to have some principles in publishing. There's also an ethic Yeah. So it's not easy to do research, especially research related to obesity, where you have like lots of similarities in how people publish, in how people do research worldwide. So we have to find our niche, our way of writing. Yeah. So when we talking about, I promise this will be the last question. I promise. I know I told you all last question, but this will be last. Maybe I should ask Dr. Sameeha about this. What do you think, Dr. Sameeha, about working with KKM? Today we conducted this webinar in collaboration with KKM, and KKM looking forward to collaborate more and more in terms of obesity research with academia. Yeah, people from academia like you, like me, like some of us in this webinar. How do you, what do you think that can be strengthened more in terms of collaboration between KKM and universities in Malaysia?
Okay, but this is just my personal opinion. I think KKM has done a lot in trying to engage so many stakeholders, including us as academicians, to be at part when we talk about nutrition. Everybody should be on the same page. I think that's very, very important. But sometimes the translation of research is what I don't really see. Not talking about KKM per se. For example, I just read about, I'm very passionate about children and school children especially, but not nutrition per se. So my answer might not really answer your question, but just listen and think and try to relate to your question, whether it answers or not. So for example, we know that children have to move a lot. They do not have to be sedentary. But sometimes our culture will be like, jangan lari-lari. Like in class, like, jangan lari, kenapa awak lari? Awak ni macam budak kecil lah, tak matang lah. Just got back from my report card day yesterday with my daughter. Her teacher said that to me. Like, she's already 11, but she's behaving like a child. And I'm like, okay. Just kept quiet, didn't say anything. But what I'm trying to say here is the translation of research. For example, research says that children need to move more. So trying to, for example, to redesign how we put the table and the chairs in classroom, and making sure that children stand up or stand down, or do the chicken dance or whatever, like in between classes, is very important for their brain development and for them to absorb more knowledge. So really, this is not related to nutrition, because I really cannot find any similar example that is related to that. So so that's number one. So trying to translate our findings, because we've worked hard as academicians to try to follow the nutrition priority research, this NRP thing, and we got the result already. And okay, so what's next? We want to help the country. Okay, in terms of policy change, in this presentation, in this webinar, we are focusing on policy policy change. But what about the setup, the design, or the like the everyday living? If we can really do that, that will be fantastic. For example, we know that unhealthy food is still is still sold in canteens, still sold outside school, but nothing has been done. Everybody was talking like, oh, go talk to your PIBG. Talk already, but nothing has been done. So
Yeah.
that's the thing lah that I see. There is one paper by Nature that says that actually school children's classroom shouldn't be so sometimes they tampal so many things to make it very cheerier, but actually not having all those is actually better for student. Did you know that? So I read that in a Nature publication. But our students class, our children's classroom lah, merdeka penuh satu kelas. Bendera-bendera tampal-tampal paku-paku. So I'm like, oh how lah. So that's what I see. Yeah, that's what I see lah. So I at the moment KKM is doing a fantastic job, I feel, but trying to translate our research findings and really incorporate that into our everyday lives is what I hope to see in the future. So that's my answer. Thank you.
Dr. Sameeha, I agree with you that we need to have more of the translational, translation of our findings to the public. Hardly is being done. But in during since pandemic, there's a lot of webinars now going on. We invite a lot of parents. We invite KKM's initiatives also have been done for parents and so on. So hopefully more and more awareness will be instilled, in these parents or school teachers and so on. But you have pointed out very good message over there. Translation is very important. Dr. Azdie and Dr. Cheah, if you have any comment, any more opinion about that, or is that what you think as well? Yeah. Okay. All right. Absolutely. All right. Thank you so much. I think that's all. We already 4:40 now. We should really wrap it up now. I really very glad, with the way we conducted the webinar today, especially with these amazing speakers that we can see, on the speaker. You have shared very well your research experience, gaps, and also your findings, a little bit on findings, and what can we do further as to improve obesity related research in Malaysia. So thank you so much from all of us in MASO, as well as from KKM, Bahagian Pemakanan, in doing this talk today. Right? Okay, so that's all. Kimberly, over to you if you have anything.
So thank you so much, Dr. Geeta, and all our speakers for such an informative and enriching session. I feel like there's a lot of work for me after this, listening to this talk. And I also believe that this webinar has been beneficial to all of us as researchers. And to commemorate this event, we will have a picture of the panel. Can the panel all smile? Okay, done. So to all participants, we also would like to have a photography session with all of you. Do turn on your camera if possible. Yeah, I'm seeing a lot of people turning on their cameras.
I see Prof as well. Prof Ismail. Hello, hi Prof. Thank you for joining, Prof.
Tak dengar, Prof.
Prof tak dengar. Prof, I think you're muted, Prof. Let me unmute him.
Sorry. Can you hear me?
Yes,
Okay,
Prof.
okay.
Boleh dengar.
All right. Yeah. No, I couldn't join in because they kata dah penuh. So I listened
Yes,
to you the talk on Zoom. No, I couldn't join in because they kata dah penuh. So I listened to you the talk on Zoom. No, couldn't join in because they kata dah penuh. What is this going on?
Prof, you kena off the FB, the Facebook.
Facebook, Prof.
Itulah I tak tahu kat mana. I just what is this going on?
You kena off the FB, the Facebook.
Facebook, Prof.
Itulah I tak tahu kat mana. I just what is this going on?
You kena off the FB. Oh, 3 kali juga.
Itulah I tak tahu kat mana. Mana dia? Kan. Yeah, every view screen on a copy link.
FB, Prof. Are you listening from your phone or from your laptop? You can phone.
View screen on a
Yeah, you have to pick either one, Prof. Cannot be greedy.
view
Are you
screen
listening
on
from your phone or from your laptop?
laptop.
Laptop, you can off the FB, tutup FB to Prof.
One, Prof. Cannot be greedy.
View screen. No, I was just now I was in a Facebook. Habis lepas tu you all dah apa still. So I was thinking, hey, what happened to? No, I was just now I was in a Facebook. Habis lepas tu you all dah apa still. So I was thinking, hey, what happened to? No, I was just now. Okay lah.
Apa lah, Prof? It's okay. Kimberly, nak ambil gambar ke?
All right, thank you so much, everybody. All participants, we would love to hear from you. Please provide your feedback by scanning these QR codes. All right, thank you so much, everybody. All participants, we would love to hear from you. And click on the link given in the chat box. Yeah, the link will be made available for 15 minutes after the session ends. Thank you once again to everybody for joining us today. And apologize for any shortcomings and hiccups, which definitely will occur in every webinar. Okay, goodbye everyone, and stay safe and take care. For those of you who would like to catch up, you can still be around here. We will close this a bit later, this platform. Thank you, everyone.
Thank you, Secretariat. Thanks, everyone.
Really, are we going to email slides to our participants, whoever who's interested to have? Yes, no?
We will on request.
On request. So yeah, just let the participant know if you want to have the slides from the speakers, you can request from the Secretariat.
Yes.
Thank you. Bye-bye.
Thank you, Dr. Sameeha. Thank you, Dr. Cheah, Dr. Azdie.
Okay, thank you. Bye.
And to all the participants as well. Hello, baby. Why?
you.